Hello, I'm Hualu Han from Tsinghua University. My topic is time course of cerebral blood flow in patients with symptomatic middle cerebral artery stenosis during lipid-lowering treatment. I have nothing to disclose. Intracranial artery stenosis, especially the middle cerebral artery stenosis, is one of the major causes of ischemic cerebral vascular disease and a strong predictor for recurrent events. It has been shown that statins are reduced-case inhibitors that delay the progression of atherosclerosis, stabilize atherosclerotic plaques, and even reduce the severity of atherosclerosis. The other potential benefit of statin therapy might be the improvement of cerebral perfusion to maintain normal nerve function and metabolism activity of brain tissue by reducing arterial luminal stenosis. However, the time course of CBF along with the changes of arterial stenosis in symptomatic patients during statin treatment is unknown. So in this study, we aim to investigate the time course of CBF along with the symptomatic intracranial arterial stenosis during the lipid-lowering treatment using high-resolution vessel wall imaging and arterial spin labeling. For the study sample, we recruited patients with symptomatic unilateral MCA stenosis, which was confirmed by MRA or CTA, and atherosclerotic plaque in MCA-M1 segment, which was confirmed by high-resolution MRI. Here are the inclusion and exclusion criteria. Finally, 16 patients finished 2-year statin treatment follow-up and received MRI examinations. Their mean age was 59 years old and 10 of them are males. After written informed consent was obtained, all subjects underwent MR imaging on the same 3T MR scanner, and the examinations were performed at 4 time points, from baseline to 6, 12, and 24 months after treatment. The MR imaging protocols include T1 Vista, Picasso, TOF, T2 FLAIR, and DWI. The detailed parameters are listed below, especially for the T1 Vista. We scanned twice, before and after gadolinium enhanced. For the Picasso sequence, we chose 1,800 milliseconds as a post-labeling delay to quantitative cerebral perfusion. The luminal stenosis was measured on the T1 Vista vessel wall images using VASED criteria by 2 experienced radiologists blended to clinical information and time point with consensus. The CBF was calculated using the Picasso images with proton density weighted images after motion correction. Then CBF maps was normalized to the standard MNI template space. The volumetric gray matter MCA territories were extracted and excluded from the infect regions observed on T2 FLAIR and DWI. Relative CBF, rCBF was therefore defined as the mean values on the ischemic side divided by the corresponding values on the contralateral side. For the statistical analysis, parity test was used to compare the LDL intracranial artery stenosis and relative CBF between last 3 time points and baseline. Of all 16 patients enrolled in this study, we could find that the LDL decreased after statin treatment. In order to figure out the mechanism, we divided patients into 2 groups based on the progress of luminal stenosis. 6 had progression in the luminal stenosis after 2 years statin treatment, and the rest 10 patients did not have aggravated stenosis. Improvements of CBF in the symptomatic territory were found among all subjects at 6 months during statin treatment, along with the decline of LDL. However, CBF showed a decrease in trend in patients with stenosis progression, whereas CBF maintained a stable level in patients with stenosis regression after 6 months of statin treatment. Here is line plots which show the alterations more directly. In the left panel, aggravated group and non-aggravated group show the different progress of luminal stenosis, and in the right panel, rCBF show different outcomes or improvements in the different stages based on the grouping. Both groups received perfusion improvements at first 6 months. Then, the degree of vascular stenosis affected the alterations of cerebral perfusion. For patients who benefited from the drug therapy, the rCBF maintained in 0.93, which could represent relatively stable blood supply. For patients with aggravated stenosis, which statin treatment may be ineffective, further hemodynamic destruction happened in ischemic brain tissues. Here is a representative example from aggravated group after statin treatment. The stenosis was located in the left M1 segment. We can find that the gray matter CBF in left hemisphere kept reducing along with the more severe stenosis. In summary, our results showed that statin treatment for symptomatic MCA stenosis would cause various outcomes or perfusion improvements in the different stages. For patients who benefited from the statin treatment, their brains regain relatively good and stable blood supply, which may contribute to the stabilization of vulnerable plaques, while for patients who had poor therapeutic effects, more severe luminal stenosis led to the further hemodynamic destruction, causing a worse chain reaction. And alternative treatment strategies such as intense statin therapy needs to be considered, but it also needs to further research. Finally, I'd like to acknowledge my colleagues and collaborators. Thanks for your attention.